and
It's
suffer
trying to
by
pain in
myself.
one part of the body is one thing, but you've basically got it all over all the time. This is just, yeah.
Yeah. Yeah. It feels like I'm rolling in cactus all the time. It's just, it's, yeah.
And I'm
So
just so sorry you've had to go through this. It's appalling. It's just,
thanks. I'm not alone. That's the more frustrating part for me because I was in the clinical trial. So there's a part of that where it's like, okay, I signed up to discover what this drug could do. And now I know very, very well what this drug can do. I am hopeful that maybe the rituximab does, knock this down. So it's, really not so bad. There's all kinds of other therapies that people can try too. There's PEA supplement, palmethyl methyl, big long word, but I can send you a link to it. But it's incredibly helpful for nerve pain. I've tried all kinds of medications for nerve pain, and none of them touched it. Right? Gabapentin wasn't for
if
me.
all the standard things, the amitriptyline, the gabapentin, the progabalin, all that
Yeah,
kind of
all of
stuff.
them, right? And they all have like a laundry list of side effects that make you a zombie. So the PEA has helped dial that down quite a bit.
PEA is a pain relief supplement that affects the endocannabinoid system. It does not directly relieve pain, but it reduces inflammation, and it helps a great deal with pain relief, even where the more expensive medications don't do anything at all. Not to be confused with the chemical involved with attention and focus with the same name. Rituxima is a very invasive drug that destroys your B cells, the immune cells that create antibodies. It's also a very expensive drug that costs $80,000 to $100,000 per year. This is used for autoimmune diseases, including those brought about by damage to your immune system from taking safe and effective medical treatments. If you are fantastically lucky enough to even be prescribed Rituxima, or anyway your case is so dire that they'll allow you to take it, you'll be taking it for the rest of your life. And it will cost even more than most people make in a year for the privilege. And it will have awful side effects as you might expect from something that goes nuclear on your immune system. PEA is not nearly so expensive, though it will probably add up over time as you'll probably have to take it multiple times a day if you really need it. You can also get nausea as well as all the usual side effects of cannabis, depression and other mood changes, paranoia, etc. And the more of it you take, the more likely you are to get some of these bad side effects. It's also only going to do so much. You can only push it so far with supplementation. Thankfully, there's a natural way that doesn't require supplements or medications at all.
Is that true?
Yeah, that's true.
No way, I can't have that. Have you got any lotions or potions? Anything?
I've seen this being done. You're extracting the resin from its belly.
No, it's not that. I just don't like this frog.
Fasting just 36 hours will increase the PEA inside your body to about 2.4 times the normal amount. I can imagine if you did an alternate day fasting routine, that over time this would go even higher. It's also worth noting that this is just one arm of the endocannaboid system, and fasting stimulates the whole thing, so you will get many benefits that PEA alone could never provide, all of which are synergistic, so you may get many times the benefits from fasting. People have asked me in the past if fasting can help with mast cell activation syndrome, and yes, it will.
So we talked a little bit about inflammation. There are two ways that PEA reduces inflammation. We talked about mast cells. Mast cells are a key player in the inflammatory cascade. They produce histamine, they produce inflammatory molecules like chemokines and cytokines. These are molecules that happen to be released very quickly, especially in the acute stages of inflammation. And PEA regulates mast cells, preventing the overproduction of these particular molecules. Think of PEA is kind of the built-in brake for the inflammation. So inflammation needs to be produced, but what is the brake? What is the regulator in the body that prevents the overproduction of inflammation? Well, PEA plays that role. It also stimulates PPAR alpha, which inhibits a key inflammatory molecule, or actually transcription factor. And this is the big bad boy that we've talked about in curcumin lectures before, but the NF-kappa beta. This is the nuclear factor kappa beta, which is a very, very strong pro-inflammatory signaling molecule. And by inhibiting this, we stop it from being produced at the genetic level.
The main mechanism of PEA seems to be inhibiting mast cell activation. Since fasting elevates PEA, you will also get this benefit from fasting. And unlike with PEA, you'll get it 24 hours a day. And on days you do eat, you can still take some PEA to give this effect a bit of a boost.
Can you walk on your own?
I can walk on my own. Because my neuropathy is progressing, the numbness is getting worse, and so I can't feel as much when I'm walking. So I actually fell down my stairs about 4 weeks ago. My daughter watched. That was the worst part. It's just because I can't feel my feet.
Yeah, you
so
don't know where you're
I'm
putting your feet. You
watching
can't
that,
feel where
right?
you're putting them.
Because
Yeah.
you know, like I have elderly parents. I understand how that goes. So now I'm like, oh, well, I'm young and definitely in senior citizen mode. So I need to be aware of those types of hazards just around the house now. So I cut open my hand pretty good, sprained my ankle pretty bad. Had to call my neighbor in to help. So that's the new reality, right? I mean, there's no certainty in any day.
Neuropathy is not just bad for your nerves, but it can be very painful. When I was having issues, I would suddenly randomly get the sensation that someone had jammed a needle into the bottom of my feet. That's what it feels like when a nerve cell dies, and that seems to be what this woman is experiencing all over her body all of the time. My problems were not nearly as severe as this woman, so I can't imagine the agony, especially since it's all over her body. The real problem here is an autoimmune reaction due to the medication she took. Her doctors pretended to be unaware of what the problem is and what's happening, but this is a bald-faced criminal behavior coming from a neurologist or a rheumatologist. It may not conform to the exact symptoms of MS or some other autoimmune disease, and actually it's much worse, but it's basically the same idea. Her own cells and the contaminant within her body is being attacked by her immune system, and some of these cells are probably still producing it, and it's just going on and on. And what's worse than her story is the fact that every single person who's exposed to these treatments is going to have the same issue to some degree, and most people are not going to associate it with these treatments. So they might suddenly be getting psoriasis, or they might be getting type 1 diabetes, or even turbo cancer, and they just have no clue where it came from. Like, it just is total coincidence, and it could happen years later. Ultimately, to come through all this, those affected cells must be removed, which is a long process and requires a fully functioning immune system. She doesn't have a fully functioning immune system, because her white blood cells have no doubt been damaged by nanoparticle infiltration, and some people could also have this issue without nearly as many side effects. They're just going to find that down the road they're less and less healthy and have no idea why. These damaged cells are going to include the critical T cells, which are required to dampen down autoimmune reactions and to fight cancer. The difference between you and a type 1 diabetic is only that you have some T cells deployed to your pancreas, which make sure that any antibodies which cause reactions with your pancreas will be dampened down at the site of the pancreas, and it'll only attack the things it's supposed to be attacking. And you can be sure that you do have some antibodies like this. Now guess what happens if these T cells are killed in some way? Very soon, you'll be a type 1 diabetic. These T cells are rare in the body and they're difficult to produce, requiring a large amount of stem cells because it has to find the perfectly trained cell in order to make a T cell that works properly, so it'll take thousands of cells. Thankfully, fasting 72 plus hours can release stem cells to generate new T cells and growth hormone to regenerate the thymus itself. Otherwise, you likely won't ever produce any new ones, since these cells can only deploy once in their lifetime and are stuck in the mode of dealing with the one autoimmune reaction. If you don't have any spares, then you're really out of luck. And all of your spares could also have been damaged if you had nanoparticles going through your bloodstream. Aside from that, there's a lot you can do to rescue these distressed nerve cells. Fasting is again one of the best ways to help, but phototherapy, methylene blue, and a low-carb diet can dramatically reduce the inflammation that's killing these cells, and it helps a great deal with preventing or even reversing neuropathy. Now, she says that there's no therapy that helps everyone, but that's not true. These therapies are going to help literally everyone, even people that don't have this kind of damage, to be healthier. That doesn't mean you can do it once and be instantly healed, but without fasting, the healing process will be very slow. In fact, it may never fully recover if your immune system is in poor shape, either from age or chemical injury, and your immune system never fully activates unless you're fasting.
But yeah, the food modification, I'm sure you've heard that before, was huge. So I cut out gluten, cut out dairy and corn, soy, and a couple of other things that set me off. And that's helped significantly. I want to say, even without the IVIG would do absolutely nothing for me if I didn't clean up my diet. And Americans, we eat terribly anyway, so I was doing myself a favor there, but it's dramatic. It helps with my brain fog, food sensitivity issues also, obviously, but the GI issues, the skin issues, the nerve pain, and the vibrations went down as I changed my diet.
The reason these foods cause issues is that undigested proteins are making it through the gut lining and triggering antibody release in the bloodstream. It drives me absolutely batty when someone talks about this or that food causing issues. You don't have a problem with a particular food, you have an autoimmune issue and a leaky gut which is triggering it. And generally this comes from a low-fat, high-carb diet. The solution is not to add in some goji berries or to switch from kale to carrots or some other nonsense. If you do that, you're just going to bounce from issue to issue your whole life. And if you follow these diet channels, that's almost always what happens throughout the whole thing. Now I'm having this, now I'm having that, and it's so much better than the other thing. No matter what food you eat, eventually you will react to it. You have a leaky gut from a bad diet, mostly from lots of sugar, lots of grains, and from not enough animal fat. Since grains are the worst offender, they should probably be the first thing removed from the diet. In fact, everyone should probably just remove them or at least limit them as much as possible, especially since you have grains like rice that are full of arsenic at over 100 parts per billion, up to 300 parts per billion. You may also have to temporarily remove eggs and dairy, but these are the two best foods for nutrition and gut health if you can tolerate them. Just make sure you have whole milk or half and half, not the gut-ruining skim milk most people are foolishly drinking today. Even if you are lactose intolerant, you will be able to drink at least 1 glass of milk a day with no ill effects. If you have issues with milk, your gut is in bad shape, and that's all there is to it. Probiotics, fasting, and more animal fat in the diet are the ultimate solution. Even the lethal peanut allergies have been cured in this manner. Though of course, if you have a severe allergy, work closely with your doctor before trying to take the offending agent again.
They've identified that I have a screaming problem with autoimmunity that is not defined. So it's not lupus, it's not one of these others that we can understand or recognize currently. And they said if I want to have a chance at all of getting on top of it, and slowing it or stopping the progression? Did I need to up my game and move from IVIG to a drug called rituximab? And rituximab is a mAb drug that essentially wipes out your B cells, and they use it in autoimmunity, MS.
Keep in mind this woman is already on IVIG, a massively overpriced drug that costs about 70 to 90K a year. Now she would have to spend another 100K per year just to stay alive using this dangerous and expensive medication. This med will probably also be harder on her than it would be with someone who had multiple sclerosis. And for people with MS, it can be fatal. And that's not surprising when you look at a medication that destroys your immune cells. Thankfully, this is not the only option. Fasting for 72 plus hours will reduce your B cells by over 50% and do it safely and without side effects. If nothing stimulates them to proliferate again, this is permanent. If you did this a dozen times, you would have less than 1,000th as many B cells. You'd have 1/4 of 1,000th as many. You might worry that this means you will die from infection the second a sniffle comes along, but when you have just a few effective B cells, your immune system can quickly bring the population up to the needed levels if that's really necessary. All this is going to do is stop the excessive overreaction from continuing on and destroying your body. If the agitating molecule is gone from the body, say the spike, this simply won't happen again. And if you do these other things, you're going to be able to get rid of that too. When you make new B cells, the body can actually make better ones with each try that are less damaging to the body if your immune system is working properly. So the more you fast, the better and less damaging your B cells will be because they'll produce better antibodies, and this is going to help a great deal with all your allergies. Someone asked if this could help with hay fever, and for me it's helped a great deal. I used to get a sore throat every year around allergy season, and for the longest time I thought I was getting viral infections, but in reality it was just strong allergies. This year I didn't notice anything at all, except I did tear up a little bit one day in April, which I wouldn't have even noticed if I weren't looking for it. So I've gone from strong hay fever each year, where I have to miss some work or some time at school, to virtually no allergies at all. This poor woman will be spending hundreds of thousands a year on meds, when a fasting prescription could probably do just as much or more and cost nothing. In fact, it'll save money because you're not eating it all the time. In fact, there are so many aspects to fasting that if they could be bottled, each one would cost at least 100K a year or more. With the fasting, you don't need Ozempic, you don't need Dasanatib, you don't need any of these crazy autoimmune drugs. You can save yourself from having transplants a lot of time because you can fix your kidneys or even your heart. And this is all if you can find a doctor to prescribe this stuff to you at all. And if you're not at the brink of death, they're just not going to do it. You're just going to have to suffer. And it does all this with no serious side effects. I fast 72 to 96 hours once per month. And on every other week of the month, I do a 36-hour fast just to keep myself insulin sensitive. But for most people, a single 72 to 96-hour fast each year is going to have a huge benefit for their health over time. If I had a condition like this woman, I would only eat once every 3 days at most, at least until it was under control. And I'd completely remove everything but beef and salt from the diet until things were dramatically better. That would immediately reduce the autoimmune symptoms right off the bat and greatly heal the immune system and gut over time. And without that, you're just never going to get over this issue. It will also activate the immune system to hunt down rogue cells that may still be shooting out allergens such as the dreaded spikes, and it will ensure that no more cells can be infiltrated and start producing more. This may seem like a lot of fasting, but your body is designed to function optimally this way. In animal studies, animals fast back to back for their entire lives for fasts that are much more aggressive than this when you adjust for their metabolic rate. And on average, they gain nothing but health benefits. In humans, it's shown that alternate day fasting in long-term studies for 6 months not only results in more fat loss compared to a long diet, but leads to zero muscle loss and zero metabolic slowing. In fact, you burn more calories. Dieting, on the other hand, quickly slows the metabolism and leads to muscle loss. You can be healthier and maybe even perfectly healthy no matter what grim fate has befallen you, but only by addressing the root causes of your problems. Pundits will argue endlessly, but there are no magical diets, medications, or special foods. There is only healthy living, and those too weak to try it.
I don't expect many of you to appreciate the subtle science and exact art that is potion making. However, for those select few, I can tell you how to bottle fame, brew glory, and even put a stopper in death.